This is a box from your textbook that's kind of a quick snapshot of a abbreviated neurological assessment. This is the one that you would do with like your daily assessment. You would assess a level of consciousness. You want to know if they're alert and oriented ×3. Are they alert to person, place, and time? Vital signs are always a key component in any system. I know you guys are well aware of that by now. Checking pupillary response to light, is it equal? Assessing the strength of hand grips and movement in the extremities when you guys are having them squeeze the fingers and push down on the gas pedal. And the ability to sense touch and pain in the extremities. So with this slide, we're talking about genetic considerations. That's on page 14, 18. Those are always important components in each system to kind of look over, just review what is considered a neurogenetic consideration. The other thing that's always important are your age-related changes in the older adult. That's on page 1419, so please make sure that you review those boxes. So we're going to start with the test on page 1416. I am skipping over the carotid duplex study. We're going to the cerebral angiogram. There is a link on this PowerPoint to take you to a video of a cerebral angiogram. You need to know that they are trying to diagnose aneurysms and thrombosis. They do use dye. There is no food or fluid 8 hours prior to the test. Bed rest 12 to 24 hours post-test. And you need to monitor for a TIA or some type of a late dye reaction in case they stated they're not allergic to iodine, but they may have never had any problems before, but then they may have a late reaction. That isn't uncommon. So just remember to make sure that you review the purpose and description and the nursing related interventions in regards to each of the tests that we're going to go over. We're going to skip over now to the EEG. So the EEG is a very pretty common standard test that they will do. It measures the electrical activity of the brain. It's used to diagnose brain disease and brain death. If you have a patient who possibly was in the unit and they are trying to determine if they want to discontinue life support, they will do an EEG to make sure there is no brain activity before they would ask the family to discontinue that and make the patient a comfort care. So this is a picture of an EEG. It's got these little electrodes, kind of like Medusa, all over your head. They are very sticky, and that stuff is very hard to get out of their hair, so they will use acetone to remove it. So just review the EEG, the purpose, and the nursing related interventions. One thing too to just keep in mind, I skip over the CT scan, the MRI, and the chest x-rays or the x-rays, but remember, usually when we are talking about any of the systems, you always want to start with the least invasive test before you would go to a more invasive test. Also depends on what they're trying to diagnose, so always keep that tucked in the back of your mind. The next test is going to be the EMG. We just spoke about the EMG, which is the electromyogram and musculoskeletal. So I'm not really going to review that so much on the PowerPoint, but if you will review that in your textbook, and there is a picture on the next slide of it. We talked about the lumbar puncture and what the fluid should look like. Remember, it's clear and colorless. This is a slide that's just kind of telling you some of the purpose and things that you would need to know nursing interventions in regards to an LP. They usually go in and they obtain a sample of spinal fluid. They're trying to diagnose multiple sclerosis or also intracranial pressure from the actual meninges, a subarachnoid hemorrhage, brain tumor, brain abscess, or some type of a viral infection. They insert a very large needle either into L3 to L4 or L4 to L5. And then, as you guys can see, there is a picture of the fetal position, which is covering the wording. You want the patient in the fetal position because that's going to open up that area for them to get a better sample. Looks like I didn't have a slide on the PET scan. This is from respiratory. We talked about the PET scan. It's used to study the brain, this particular one, and we're trying to assess brain function and cerebral blood flow and volume. They're also trying to differentiate different dementia and stages of brain tumors. So just as in respiratory we were looking or trying to diagnose lung cancer, this is looking at the brain. So make sure that you review the PET scan, which is on page 1418. So we're starting into the neuro assessment where we're talking about the cranial nerves. Remember, before we talk about that, we have not talked about the health interview questions. That's always a big old box in your chapter on page 1420. So you guys can review that box. So one of the things that we want to start with is mental status. We want to know if the patient is cognitive function. Are they alert and oriented? The other thing is you can use a Glasgow Coma Scale, which is in table 41-5 on page 1421. You guys do need to know this scale and review it. It is an important assessment tool to indicate if the patient can open their eyes, their motor response, their verbal response, and then you give a total score. Typically, you would have a score of 15. That means the patient is perfectly alert and oriented. Remember, when we're looking at abnormal findings, there's some of those terminologies like aphasia. This occurs with TIAs and strokes. It's usually absence or difficulty with the language. So make sure that you're familiar with those types of terms. When we talk about assessing cranial nerve number 1, we want to know that is olfactory, and you usually ask the patient to smell something. Typically, they use coffee, and they occlude one nostril, smell, occlude the other nostril, and smell. Moving on down the cranial nerves, cranial nerve 2 is optic. You would use the Snelling chart to assess vision. Then I have grouped together what you see cranial nerve 3, 4, and 6. This is your ocular motor, trochlear, and abducens. You essentially ask the patient to follow your finger, and you are essentially making an H. And you're also assessing your perla to make sure that they have reactions to the light. The other thing that you are assessing is cranial nerve 5, which is trigeminal. With trigeminal, you're assessing the ability to feel that light, dull, and sharp sensations on the face. You may have heard patients having trigeminal neuralgia. This is where they almost simulate like they have a stroke because they have a face pain, but it's not. After they do all the assessments, it is not indicative of a stroke. This brings us to cranial nerve 8, which is acoustic. Think acoustic, playing music. You hear a ticking of a watch. You put your watch up to their ear and ask them if they can hear that faint sound. Then we are assessing. So that also brings us to cranial nerve 9 and 10, glossopharyngeal and vagus. This is where you're assessing the gag reflex, opening up and say ah, the ability to taste salty, sweet, and sour. Then we move on to cranial nerve 11, spinal accessory. This is the one where you're asking them to shrug their shoulders, turn their head side to side, and it's against resistance. Then the next is cranial nerve 12, where we're looking at hypoglossal. You ask them to stick out their tongue, move side to side. Then after we leave the cranial nerves, we're going to assess strength and movement. So just make sure that when you listen to the podcast, you also correlate with your textbook the different ways to assess the 12 cranial nerves. We will also do it in lab, but this will just kind of give you a little bit more familiarity of them so they're not totally seeming far and existent. So that brings us to sensory function. Can you feel the touch? We talked about the different touch. We talked about, we haven't talked about. There's two different terminologies for graphesthesia. This is where you write a number in a person's hand. And then you also have where you're doing a testing 2-point discrimination. So what you would essentially do is take two ends of a Q-tip and pin prick the patient's hand to see if they can feel both of the points. And then when we talk about gait and strength and muscles, we talk about the Romberg test. This is pretty indicative test. This is where you have a patient actually stand, and they stand with their feet together and their eyes are closed, and you want to stay with the patient because they may get a little swayy, especially when they stand next to you and close their eyes. They may not feel very comfortable doing that. There should be minimal swaying up to 20 seconds. If you have a patient who has a positive Romberg's test and they have maximal swaying, that is indicative of a cerebellar ataxia. So now we're about to page 1426. I just want to let you know the little section there on the deep tendon reflexes. It is important. Goes with neuro, but there are so many other things in the neuro chapter that are more important. So that's why I talk about the deep tendon reflexes with fluid and electrolytes and with endocrine. So you guys can review that. Do not study that hard. Deep tendon reflexes is not going to be on the neuro test. You have 12 cranial nerves that I want you to be familiar with and understand some of the terminology. So that brings us to Bambinsky's and Brudinsky's sign. These are two words and assessment techniques that you guys do need to be familiar with. So please review them in your textbook. And you guys will also perform them in lab on each other. The other one that is not up here is called Koenig's sign, which is on page 1427. Then at the bottom of 1427, you can see something called decorticate posture and decerebrate posture. The way I always remember decorticate, these are abnormal postures seen in patients who are unconscious. Decorticate, they're pulling their hands to the core. So decorticate, hands are to the core. And decerebrate, you're seeing you out. I'm pulling my hands out, so I'm seeing out. So review over those, and this should conclude the neuro chapter. And make sure that you guys review the PowerPoints, the podcast, and then you guys will do the actual neuro assessment when you guys come into lab.